We are here in Bologna with Professor Ethan Basch, who has been and is a pioneer of the implementation of electronic patient-reported outcomes in clinical practice for patients with cancer. So, Ethan, what would you recommend to Italian oncology community to adopt electronic patient-reported outcomes in clinical practice?
Well, I've enjoyed a number of conversations the last 2 days at your meeting, and I've been fascinated to see that many of the challenges in the Italian healthcare system are very similar to the ones in the United States. Even though our payment models are different and our resources are a little bit different, many of the same issues exist, which is that we face challenges having enough personnel and resources to meet all of the needs of our patients. And this leads to questions about how do we implement patient-reported outcomes, because of course patient-reported outcomes ultimately depends on technology infrastructure, having resources for implementation in the way that we think about any kind of quality program, and it also requires having personnel, generally having nurses, who can respond to that information. Now, regardless of the amount of resources in a system, in order to implement PROs well, it really does require a very thoughtful approach to how we build out these programs. The first is that the technology has to be easy to use for the patients, and it has to be easy to use for the staff. And so the selection of the technology is really very key in the beginning of when you think about this program, because we've seen many implementations where the technology was not user-friendly, the passwords were complicated for the patients, or the software was very difficult for the nurses to access, and those efforts fail. So the software has to be right. The second is the implementation process from an organizational perspective. This kind of implementation has to be thought of like any quality program. For example, if we implement a new electronic medical record system or a new approach to managing any aspect of the chemotherapy for the patients. And so there need to be coaches and there needs to be some leadership investment so that there is monitoring of the program over time. And then the third is that the nurses really do need to have extensive training at the beginning and understand that there will be more work at the beginning, but later on there will be less work because you're going to catch symptoms early before they worsen.
Thank you very much. Thank you.
My pleasure.